Hi, good afternoon. My name is Terika Thomas Mills, and today I'm going to be demonstrating IV fluid and med administration. I'm going to start by performing my hand hygiene, and then I'm going to apply my gloves. So I have gathered my supplies. I have my primary fluid. I have verified the physician's order in the MAR. I have verified the 6 right of med administration. I have verified that I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. For my primary tubing, I have my macro drip set, and it's macro drip at 15 drops per minute. Next, I have my amoxicillin, my medication piggyback. The doctor has prescribed 250 milligram of amoxicillin, and it's to run over 15 minutes, and it is supplied in 100 milliliter piggyback. For this medication, I have also verified the 6 right of med administration. I have verified that I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. I have also verbally verified with the patient that he has no known allergy to amoxicillin, and I have also checked in his chart to ensure that he has no allergy to amoxicillin. I have my secondary set, and this is macro drip. I have my secondary set, and it is macro drip at 20 drops per ml. I have my alcohol prep pad, and I have my piggyback hangers. So before I start, I am gonna do my calculations. So for my fluid, the doctor has ordered 150 ml, and it's to run over 15 minutes at over 60 minutes, and it is to run at 15 drops per ml, and that would give us an infusion rate of 38 drops per minute. For my amoxicillin, which was ordered in 250 milligrams, and it is supplied in 100 milliliter, and this is to run over 15 minutes, and it is to run at 20 drops per ml, and that would give us an infusion rate of 133 drops per minute. Okay, so I am gonna start by spiking my primary infusion, and so I have my tubing, and with this tubing I have my spike end, and this is to remain sterile since this is what is introduced into the medication bag. I have my drip chamber, and this is what prevents air from going in the tube, and it also allows us to visualize our flow rate. Next, I have my roller clamp, and this is what adjusts my flow rate, and at all time I need to ensure that we start with it in an off position. Next, I have my Y-site, and this is used for medication administration via IV bolus or IV piggyback or secondary infusion. And when we use this site, we want to ensure that the medications are compatible with each other. And finally, I have my adapter end, and this is what goes into the patient. This is what gets connected to the patient's IV site. So I am gonna spike my bag. I'm gonna start by removing the top from my spike. I am gonna remove the top from my bag, and then I'm gonna go ahead and I'm gonna spike my bag. Okay, so since I know that I am gonna be doing a piggyback, I am gonna hang my fluid, but I'm gonna hang it on the lower. I'm gonna hang it on the lower end of the rack. Okay, so next I am gonna go ahead and I am gonna slowly squeeze my drip chamber until it's half full. Okay, so now that it's half full, I am gonna go ahead and I'm gonna prime my line. I am gonna slowly open my roller clamp. I'm gonna slowly open the roller clamp and I'm gonna allow the fluid to run all the way through until there are no air bubbles left in the line. Now that the air bubbles are gone, I'm gonna go ahead and I'm gonna close it. All right, so next, since I have primed the line, I would take my alcohol prep pad and I would clean the patient's IV site, and then after I clean my patient's IV site, I would allow it to dry for a minute or so, and then once it's dry, I would go ahead and I would attach my primary line. Okay, so now that the line is attached to the patient, I am gonna go ahead and I'm gonna check my infusion rate. I need to ensure that my infusion rate is correct. So I am gonna go ahead and then I'm gonna slowly open my roller clamp, and then I am gonna count for 1 full minute to ensure that I am getting 38 drops per minute. So I'm gonna go ahead and I'm gonna slowly open my line, and then I could always adjust my flow using my roller clamp to ensure that I'm getting my accurate drip rate. So I'm gonna count for 1 full minute. Okay, so I have counted for 1 full minute, and I can correctly confirm that I have 38 drops for that full minute. In the real world, I would allow my infusion to continue, but due to limited supplies, I'm gonna go ahead and I have paused my infusion due to limited supplies, and now I'm gonna go ahead and I'm gonna set up my piggyback. So I'm going to take my secondary line, and as usual you want to ensure that you start with the roller clamp in an off position. So I'm going to go ahead, I'm going to remove the top, and then I'm going to spike my bag. Okay, so now that I have spiked my bag, I'm gonna go ahead and I'm gonna hang my medication, and I want to ensure that both bags, my medication and my fluid, are hung at least 30 inches above the patient's IV site. So again, I also have to prime this line. I am going to go ahead and I'm going to squeeze my chamber until it's half full. Okay, and now that it's half full, I'm going to slowly open my roller clamp. And then I'm going to allow the fluid to go all the way through until there are no air bubbles left in the line. So now that I have removed the air bubbles from the line, I am going to take another alcohol prep pad, and I am going to clean my Y site. I'm going to clean my Y site, and then I'm going to allow it to dry. And when it's dry, I'm going to attach my secondary tubing. I'm going to attach it to my primary tubing. So next, now that it's attached, I am going to go back up my roller clamp, and I am going to slowly open my roller clamp. So I'm going to also have to check the infusion rate for this. I'm going to slowly open, and again I have to count for 1 full minute to ensure that I am getting 133 drops per minute for my antibiotic. So I'm going to slowly open, and I'm going to count for 1 full minute. Okay, so I have counted for 1 full minute, and it's actually 133 drops per minute. So I would verify and assess the patient's I would reassess the patient's IV site. I'm gonna check to see if there's any signs of any signs of infiltration, any redness or any swelling, and if there's any sign of this, then I would pause the infusion. And since amoxicillin is a moderately high risk allergy medication, I am going to stick around to see if the patient is experiencing any signs of hypersensitivity or allergic reaction. Okay, the patient seemed to be tolerating the medication properly. So I would ensure that the patient is in a position of comfort. I would ensure that the bed is in a low and lock position. I would ensure that the patient's call light is within reach. I would discard my supplies, remove my gloves, perform my hand hygiene, and go document my procedure.